Hello everyone, my name is Rebecca Perfecto. I am the Director of Admissions and Recruitment for UNT Health, and today we are here to talk about our brand new Masters of Science in Clinical Nutrition. And so we have brought to y'all some VIPs from our program. We have some faculty members that are going to be talking to us a little bit about that, and so I'm going to have them introduce themselves.
Hello, I am Dr. Christina Liu Newell. I am a registered dietitian nutritionist. I currently serve as the program director of the clinical nutrition program.
And my name is Jennifer Mills. I am also a registered dietitian nutritionist and an assistant faculty member for the program.
Excellent. Well, thank you both again for joining us today. We have been getting quite a few questions from students, so we wrote some of these out for y'all to help answer them. That way students can watch this whenever they'd like. What is a registered dietitian nutritionist, and what are the requirements to become one?
A registered dietitian nutritionist is a healthcare professional who has been trained to address nutritional needs of individuals in clinical and in community settings. They are trained to promote health and well-being and also provide medical nutrition therapy to people with a variety of health conditions. To become a registered dietitian nutritionist, they must complete an ACEND accredited dietitian education program, a minimum of 1,000 hours of supervised practice. Since 2024, they are required to have a minimum of a graduate degree. And once they meet all those requirements, then they need to take the exam, the National Credentialing Exam, to become a registered dietitian nutritionist.
That's excellent. And so can you give us a little bit of that, brief overview of our clinical nutrition program and what separates us from maybe others?
Of course. The Master of Science in Clinical Nutrition program is a coordinated program designed to prepare students to become registered dietitian nutritionists. The program includes the dietetics coursework, the supervised practice hours, and the graduate degree. So when students complete this program in 2 years, they'll be ready to take the exam to become an RDN, which stands for Registered Dietitian Nutritionist.
All right, so I did have a question. Earlier you mentioned that in order to become an RDN, students have to complete an ACEND accredited dietitian program. Can you tell me a little bit more about that ACEND accreditation and where our institution is at the moment?
So our program has applied to the ACEND accreditation last year, and we had a very successful site visit, and we have been granted candidacy status by ACEND, which means that students that complete this program will be eligible to sit for the exam to become an RDN.
Excellent. And so I would think that would be also important for students to kind of, as they're doing their research, they need to be looking for either ACEND accredited programs or ACEND, and what was the term that you mentioned? Candidate programs as well. Okay, perfect. So we will make sure that we're relaying that to our students as well. How does this program really prepare our students to become leaders in that field, right? How do they break through the rest of the pack?
So our program has several classes dedicated to leadership and management so that our students can really learn those skills and prepare them for diverse practice settings. Our curriculum is scaffolded throughout the program to really build that critical thinking and judgment and prepare them for those leadership positions.
And so what sets our program apart from other programs in Texas or even nationally?
What makes our program unique is that our program focuses on evidence-based practice, interprofessional education, and leadership development. So when our students graduate from the program, they're ready to collaborate and work with other healthcare professionals and be leaders in the field.
And what are some of the signature courses or those learning experiences that students can expect?
So one of the standout experiences in our program is our clinical skills practicums. They're held at our state-of-the-art regional simulation center. And these courses offer a high fidelity but low stakes environment where students can build and refine their clinical skills before they enter their supervised practice. It's a really hands-on and immersive way to bridge that classroom learning with real-world application, giving students a lot more confidence and competence to excel in those clinical settings. Another signature component of our program is the capstone project, which is completed over 3 courses. So students will conduct a literature review on a topic of interest, analyze the data collected, and then lastly, they'll present their findings in a poster presentation. So this project really allows students to integrate that research, critical thinking, and communication skills, preparing them to really contribute to the field of nutrition and dietetics in a confident and evidence-informed way.
Excellent. And so tell me a little bit more about those hands-on, like what can they expect? I know that, it's definitely going to grow their confidence because they're not actually going to be working with real patients just yet. Tell me a little bit more about those hands-on opportunities, labs, and case studies.
So it gives them an opportunity to practice in a high fidelity but low stakes environment. So we'll be using things like standardized patients to simulate those actual patient interactions. They'll be using mannequins to do some hands-on training for different clinical skills, such as taking, basic measurements such as blood pressure and blood glucose, but also skills like placing a NG tube or a feeding tube.
That's excellent. I know that students can often hear about a capstone project and feel a little intimidated. So I appreciate that, breaking it down into different classes and kind of carrying them through. So that is fantastic. I'm sure that will appease a lot of minds. But I know that y'all have incorporated a lot more of a hands-on lab and case studies. Can you describe that hands-on opportunity students receive?
Absolutely. So in our regional simulation center, they're going to have the opportunity to go through different clinical skills in that really low stakes but high fidelity environment using things like mannequins and standardized patients. So it's that opportunity to interact with what they perceive as a real patient in order to build those counseling skills and then also the clinical skills such as taking blood glucose, blood pressure, and even placing an NG feeding tube.
That is excellent, especially because, again, it's part of that IPE training, right? That experience at UNT Health has really, really encouraged all of our programs to embrace, which is collaborating and working as a team. So once they have finished with the simulation and all that, I know our students want to, get hands-on opportunities. So at what point do our students begin their clinical or that practicum experience?
So during the first year, students will start with the online dietetics courses. And then right after the first two semesters in that summer, they will start their first supervised practice rotation in community. They will be in the community rotation for 6 weeks. And immediately after that, they will come to on campus for 2 weeks of immersive simulation experience.
Got it. And so as they are doing that, what types of healthcare and community settings do our students train in?
So during the community rotation, students will be placed at the community agencies, such as like a Parent Area Food Bank, Meals on Wheels, YMCA. And then during the clinical rotation, students will be placed in hospital, long-term care facilities, outpatient clinic, or maybe a private practice clinic. So they get to see a variety of clinical settings. And then for management rotation, students will go through either a school food service management or a healthcare food service management, maybe even like some of those what we consider community food service operation like a Meals on Wheels.
Great. And so another one of the things that UNT Health is known about is that faculty support. So we know that it is extremely stressful for our students. We know that many of them are managing families at home, full-time course load. So how would you describe the faculty's approach to teaching and mentoring?
Absolutely. So our passion for teaching and mentoring is what drew many of us to higher education in the first place. And so even though this is an online program, our commitment to student engagement has really been at the heart of everything we do. We will provide opportunities for students to interact with their peers and faculty, and we really want to make it a priority to be accessible, responsive, and supportive to ensure that our students feel seen and heard.
That's fantastic. And what kind of one-on-one support should students expect?
So student engagement and interaction are really our top priorities. We're deeply invested in providing meaningful one-on-one support, whether that's through virtual office hours, timely feedback, or just ongoing mentorship throughout the program.
And in addition to faculty support, a student will also receive support from program director like myself and our academic program manager and the clinical site coordinator. So students are welcome to reach out to me for any guidance or advice. If they just want to talk to me, they're welcome to contact me. And the academic program manager will kind of keep track their progress and their competencies. And the clinical site coordinator will assist them with placement at the supervised practice site and also making sure they complete all the onboarding documents to start their rotation.
That's excellent. That sounds like a whole package. So our students are going to be well supported, not only by our Division of Student Affairs, but also by their faculty and their program. And so let's talk about once they're done, right? They have completed absolutely everything. How does the program prepare students for the registered dietitian nutritionist credential exam?
So our curriculum has really been carefully mapped to cover the knowledge and skills necessary to become a registered dietitian nutritionist. In addition to the student learning throughout the entire program, we actually have one of the final courses that includes a review specifically for the RDN credentialing exam. So we really want our students to feel confident and well prepared as they enter that exam.
Thank you. And what are some of those employment opportunities once they've graduated, once they've passed that test, where do they go?
We want our graduates to get employed after they finish our program. And there are many opportunities out there. If they can just search the internet, you'll see a lot of job listing for dietitian's position. So typically, our students can find employment in clinical settings such as the hospital, the long-term care facilities, or even outpatient clinic. They can also work in the community agencies that have a nutrition program, or even maybe like a wellness corporation. A lot of the corporations have wellness program nowadays, so students can go coordinator or run the wellness program. And students also have management opportunities. They can become manager for the clinical nutrition departments, food service manager for healthcare food service facilities, or even school nutrition.
Oh, great. And so I know that one of the things that I like to share with our students as we're talking about our programs and the importance of, working as well in a health science center, right? So not just, going into clinical nutrition, but being part of UNT Health Science Center. How do our students collaborate and support each other during that program, right? Like, so they've been approved to be part of our clinical nutritional program. How do they collaborate? How do they work with others?
So even though it is primarily an online program format, collaboration and peer support are central to our program. The students are going to connect regularly through group projects, discussions, and even interactive role-playing to build those clinical and communication skills with each other in the low-stakes environment. And these experiences help to foster a strong sense of community and teamwork.
And to add to that part, the interprofessional education is embedded throughout our curriculum. So students will have the opportunity to learn and collaborate with other healthcare students, such as students enrolled in TCOM, in pharmacies, and physical therapies program. So they will have that learning experience together.
That's excellent. That's why I'm always encouraging students, make sure that the institution that you finally pick and that you decide has an opportunity like this, right? We want to encourage that IP, that interprofessional experience, because in that way, once they hit that job market, they're going to be able to know how to communicate with other healthcare professionals, right? And make those decisions for best outcomes for their patients. And so this wonderful program, we are working towards that ACEND accreditation. And so what qualities do you look for in a strong applicant for this program?
Our admission criteria requires students to hold an undergraduate degree from any major, so they do not have to have a nutrition degree or a DPD verification statement. They do need to have a minimum of 3.0 cumulative GPA and complete all prereqs with a C or better. So beyond that, we take a holistic approach to review the applications. We will review the academic achievements, their work experience, volunteer experience. We will look at their personal statement, their recommendation letter, and just kind of look at it from a holistic point of view. And of course, we are always looking for students who are motivated, who are professional, and absolutely passionate about the field and wanting to make a difference in the community.
Absolutely. And so, what advice would you give to someone considering a career in clinical nutrition?
Absolutely. So if you're passionate about health, science, and helping others, a career as a registered dietitian can be an incredibly rewarding path. It's a field where you can make a real measurable impact on people's lives in so many different settings. So my advice would be to stay curious and remain open to the vast array of opportunities that you have, and then to build strong communication skills. So don't be afraid to ask questions, connect with mentors, and explore the many different options that the field can provide.
That's excellent. And so, lastly, our last official question, why should a student choose this program now at UNT Health?
There are 3 reasons why they should choose the program at UNT Health. First, students can follow a seamless path to become a registered dietitian nutritionist. They can complete the program in just 2 years by completing the dietetics coursework, the supervised practice experience, and the graduate degree. And then they'll be eligible to sit for the exam. Right? Second, students have the flexibility to complete the coursework online, while they also get hands-on experience through our simulation and supervised practice rotation. And third, our program's emphasis on interprofessional education and leadership development. So students are prepared not only to become a skilled dietitians, but also to be ready as a change maker, as a leader in the community.
Well, thank you so much to our faculty for joining us today. And for those of you who are interested in applying to this program, we do have a few offerings for you. You can visit our UNT Health admissions page, and there you can either self-schedule for our next information session. We also have application waivers. So if you're interested in an application fee waiver, please book a one-on-one with our team. Or if you have any type of questions, you can go ahead and self-schedule an appointment for you to meet one-on-one with our team. Lastly, we are offering hands-on help filling out the application. So if you would like for that, please go ahead and email us admissions@unthealth.edu or for any questions that you might have. Thank you so much for joining us today. And again, we look forward to seeing you here in the fall.